Like so many other pandemic mothers, Victoria Reade has spent much of maternity leave in social isolation.
My plans for, mom groups and doing baby yoga and all of that stuff sort of fell by the wayside a little bit.
For little Holly, it's meant less interaction with new friends and less exposure to germs. Only that's not necessarily a good thing.
These kids are being immune deprived and their microbes are being screwed up, so their immune systems are a bit screwed up.
Called immunity debt, it's what doctors explain as a lack of immune stimulation due to a reduction in exposure to viruses.
The countries that have been have applied quite successful measures to stop COVID-19 transmission in the community will be seeing these effects.
Wellington-based epidemiologist Michael Baker says in New Zealand, reopening has led to a resurgence in a serious respiratory illness known as RSV. And the surge, he says, is putting a strain on local pediatric wards.
There were 1,000 cases a week ago, and that's almost the number we might have for a whole winter.
A recent study found countries like New Zealand aren't alone. Australia is also facing a rise in RSV cases as lockdown measures lift, and experts say Canada isn't immune either.
I think we're going to see a big spike in that in kids in the next year or so.
Back in Calgary, where Stampede is in full swing, Reade says she plans to steer clear of crowds, wash her hands, and socialize Holly slowly.
I do think it's also important to try to ease back into life so her immune system can be built up.
Ultimately, experts say parents shouldn't worry. Babies born during the pandemic have a less than immune system. Kids don't need to catch a severe illness to create robust immunity. Vaccinations and simple hygiene are still the best course of action.